I really became interested in urogynecology on my rotation and residency. I had been realizing that I was more interested in surgery than in the obstetrics part of OBGYN, and I just really came to love the patient population of urogyn, really helping patients with their quality of life needs, and really getting to focus on a more niche area and honing my surgical skills. My mentors in residency really highly recommended the program here at UW. I came in to my interview already with a good feeling about it, and I really liked how all of our attendings here come from different places, so we get to really see a wide breadth of different approaches to both surgical and clinical management for patients. The best part for me was realizing that urogyn is really what I want to do. In residency, I only did a couple of months of urogyn, and really getting to do it day in and day out has made me realize that this is what I want to do. I've really enjoyed getting to know all the residents who have been really welcoming, all of the attendings who have showed me the ropes, getting to dive right into surgeries and experiences in clinic. And I think the department in general has been very welcoming. Dr. Hartenbach introduced herself to me on one of my very first days, and all the generalists and everyone else in the department has been very, very warm and welcoming. We have a good balance between clinic and OR. A little bit more operating room, which is great to learn those surgical skills, balanced with getting 1 or 2 days in clinic a week as well, to really work on the skills of getting patients ready for the operating room and seeing them post-op, managing any complications and things like that. We have a really well-rounded team in our clinic. We work closely, of course, with our medical assistants when we see patients in the clinic. In addition, we have a large complement of RNs that we work with in the clinic setting, but also they are helping us manage patient calls and inbox messages. And so we collaborate closely with them on kind of helping address patients' needs, especially patients who are not physically in the clinic at the time. And then we have a great relationship with the APPs. They also were very welcoming to me when I first started. They come to us with questions if they have questions about more complicated medical management or surgical management of patients. And then, of course, I still have so much to learn from them. We learn from them things like pessary fittings, pessary management in the clinic. So it's a great relationship. So far, the things I've really gotten involved in are quality improvement projects. One is to look at the possibility for patients to remove their Foley catheters on their own at home after surgery rather than having to drive in for another visit in the clinic. It's been shown already to be safe and effective, and I'm hoping that it'll be helpful for our patients here, a lot of whom have to drive pretty far to come into clinic. And then another quality improvement project that I'm working on is related to pre-op optimization of patients and looking at who really needs more close attention in terms of their medical needs prior to surgery, who needs to go to their primary care doctor in order to get additional testing to make sure surgery is safe, and looking at our process of the number and type of in-person clinic visits we have prior to surgery to really see if all those visits are necessary. The relationships with the faculty have been great. We really get to work with all of them from the beginning. I feel like I was really in the operating room or the clinic with everyone kind of equally, which was really nice to get to know everyone has a different style, different ways they do things surgically and clinically. So it's been really nice to work with everyone kind of equally to learn all those different ways. And I think everyone has been very cognizant of the fact that I came here from out of state. I moved here from Texas, not really knowing the area or people here. And so one of the attendings, Dr. Pennycalf, has invited me over to his house to join his family for Thanksgiving. Everyone has been checking in on how I'm doing, especially with the winter and with settling into medicine. Madison has been amazing. Everyone has been so nice. We've become friends with several different neighbors. I have gotten to know some of the other fellows, the OBGYN first-year fellows. We've gotten to hang out with them, which has been really fun. We moved here in August, so towards the end of the summer, so I'm really looking forward to this next summer to really take advantage of all the outdoor activities here in Madison. I'm not quite sure yet what I want to do in terms of academics or private practice, or kind of what that balance will be like between clinical and research for me in the future. I do know that I want to at least primarily be clinical, so I think here we're really getting a well-balanced education of a lot of good surgical training, good experience with clinical management as well, and then of course our research education in order to prepare us for kind of any of those career options. The benefit of being a slightly newer program is that we're still getting to kind of shape the way that the program runs and getting to have a voice in what is important for our training and our career preparation. And I think that the division has been very receptive to kind of what our needs are as trainees. The second thing is having attendings from all different training programs in the country is that there's not one UW way of doing things. And I think that learning a lot of different types of skills and different ways to approach a problem is super beneficial, because there's already been ways that I have seen as a first year fellow in the operating room where, you know, there's a typical way someone usually does something, and in some patients that doesn't work out, and it's a really important skill to have in our toolbox, other ways of approaching a problem. And so I think that's something that I didn't realize as an applicant, how beneficial it would be to go to a place that will teach me so many different types of ways to address the same problem.